All right, ready?
I'm ready. Let's do
All
it.
right. Hey guys, welcome to episode 2 of the Good Code Podcast. I'm here with a oldie but goodie, a longtime friend, mentor, and former boss of mine, Les Becker, who I've known for over a decade now, and extremely excited to sit here and today explore his story, his journey, and talk about some of the awesome things that he has done over the past, I'm going to say 20 years of his career. I've only been a part of about 10 to 12 of those. So great to have you, Les. Thanks for inviting me up here to Denver to come and talk to you. Extremely excited about this conversation because I don't think folks have actually really heard your story and about a lot of the things that folks are seeing, even down in Houston, Harris County, that are normal staples today, or even up in Washington State, where you were, that you had a hand in those. And really want to tell and articulate that story, and really want to understand like who you are. And you at one point started over in the private sector, and then you came over to public sector. And what was the drive and the ambition behind that? You know, especially when you look at it and say, why would anyone want to come and work in government?
Well, it's certainly been a long journey. You make me feel dated, so thanks for adding a couple of decades in there. And I would correct you in one part. I would say more colleague than boss, because we had great synergy, and when we worked together, I never felt like I was directing you. We were just trying to figure out how to do the most stuff we could in the environment we're in. So just a slight correction there. But you know, I got into government service in this weird way because I'd been with Texaco and AT&T more on the technology side and some on the administrative side, had a lot of project management experience, and just decided that wasn't for me. And took a big leap, which my wife will kill me for, and just left the job and took a severance package at the time, but didn't know what I was going to do. And along the way, it didn't work out as easily as I thought. So, you know, certainly she would have preferred the job came around a lot sooner, but ended up getting an offer to go work in Harris County at the Flood Control Agency. And you know, if you remember that agency, it came on the heels of Tropical Storm Allison, where it wasn't a hurricane, but it really flooded the entire community and devastating in many places, including the downtown area where the hospitals are, and all the infrastructure was in the basement at the time. So there was this big influx of money. And they said, hey, we're trying to set up a PMO. We do this $30 to $40 million worth of engineering construction per year. We need to take that to 125 or so. And we need the processes and the protocols and the structure to make that happen. And so I joined and went to work for them, and we were successful, and it was great. And I did that for about 9 years, ended up taking over the administrative back-end services, HR, finance, operations, the PMO, IT for sure. But one of the things that I just realized is people get mad when they flood. They don't really care when they don't flood. And so from a public service perspective, what was really missing is seeing the impact on community and people that are feeling the impact of your services in their daily lives and are grateful for it. You just didn't get that from the flood control.
Absolutely.
Even though it was fantastic work that was happening, you just didn't get it. So an offer came up at public health. I'd never heard of public health in my life, didn't know really what it was. Went and did the interview, and it just seemed like a match. The passion that the public health people in that room on that interview panel, I'll never forget, was amazing to me. I don't think I'd ever seen that in a workplace. It wasn't so much about what I could bring to them, it was about what they wanted to get done in the community and how I could help make that happen. And I found that pretty inspiring. And so joined them, spent a couple of years in the COO, CFO role, doing the finances and all the same things I'd been doing at the Flood Control Agency. And then, you know, Dr. Shaw, who you know, my mentor, your mentor, became the director of the agency. And we had a great working relationship. It started off rocky, I won't lie. In my interview process, I thought they gave him the cliff notes of the wrong person, because this guy was just peppering me to death. He wouldn't stop, on and on. I'm like, did somebody tell you the first interview went really well? You can slow down. But it went second. We got past the interview. I got the job. He took over as the director, and he took a leap of faith on a young kid from Orange, Texas, a very small town on the border of Louisiana and Texas, to be his deputy director. And I'll never forget that leap of faith that he took in me, because it was a big leap for him to take, but also precedent. There had never been a non-MD in that position.
Absolutely.
And so it was a big step and a leap forward. And it's such a fun journey with him for about 7 or 8 years in that role. And you came on, we did the 1115 waiver project, and we got this influx of money. We ran it like a business, which was so unusual for public health. I think our operating expenses were 10% of the incentive payments that we were getting. And we can certainly talk more about it, but we created the ability to go anywhere in Harris County, which is the size of Rhode Island with a population of 5 million people, and deliver every service that public health agency had, no matter when and where we wanted to do it. And I think that's probably one of my favorite memories and one of the things I'm most proud of.
Yeah, absolutely. So I remember, coming on board, and around this time, I think when you were taking on your role at public health, I was still in the big healthcare side. I hadn't made it to the agency just yet. And I remember interviewing with environmental public health.
Yeah.
And during my interview, the question was, if you had a flat tire, how would you change the tire? And I went through this process, and I think I exhausted them because about 20 minutes later, I had finally changed the tire. And I remember the director asking me and saying, you do know where you're leaving, and you do know where you're coming to. Yeah. And I think I had the same kind of feeling that you had when you were at Flood Control. Here I am over at this hospital system. I'm doing some very transactional work. It's meeting the need of the business, but it's not necessarily checking a box of why did I come to this work. I came into healthcare to help people, and the most I could do to help people was give them the right bill and to make sure that their insurance coordination of benefits were correct. And it wasn't fulfilling. I came over to environmental, and I was like, I'm going to use this biology and chemistry degree that I went and got that I had never used, and got into foodborne illnesses and all this stuff. And then somewhere along that journey, I get this reach out from you and Dr. Shaw, who then bring me back into healthcare and saying, do you understand KPIs? Do you understand metrics? Do you understand healthcare delivery? Do you understand ER utilization? Do you understand Medicaid? All right, great. We have these projects. We want to write for them. Let's go get it. And then I'm so thankful for this moment. You said, well, since you wrote them, why don't you run them? And
that was pretty strategic on my part, because I didn't want to run them.
Yeah. So he said, since you wrote them, why don't you run them? And I just, okay, okay. And Rocky at the beginning,
It was a startup in the truest sense of the word.
It was a true sense of a startup.
It was something that had never been done in public health that way, where people were very skeptical. Yeah. And we had to go out and prove them wrong. And that was the kind of the vision, and you just ran with it.
Yeah, and I want to kind of talk about this different flavor, I'm going to call it flavor, that you brought to the agency, especially as it related to 1115 and the things that came out of it that actually transformed the health department. Because you did see it differently. Between you and Dr. Shaw, y'all saw what could be and not what was. And I saw an opportunity in there where I was working for two true visionaries who said, we don't want to do what we have historically done, and we want to get off the hamster wheel and do this thing a little different. Yeah. And so you took that approach from physical infrastructure all the way to office design, to the makeup of the teams, to the freedom and autonomy that you all allowed me to do. And that sometimes was like, okay.
The gumbo parties were good. I would just want to say they were one of my favorite things that came out of the whole deal.
Yes.
But the interesting part is when we looked at the 1115 waiver, and I think you even went to some of the conferences in Austin with me, everybody was looking at it and saying, okay, I get this money. How do I spend all of it doing the thing? And what I realized quickly is there was actually an opportunity to use that money to make all the boats in public health lift up, and not just those specific programs, because you didn't have to spend all the money to execute that way. It was called an incentive payment for a reason. The incentive was to get extra money for the rest of the health department to be able to expand great ideas where they were happening. And I mentioned the flood control piece, and I think interesting dynamic for me was I felt like I did a really good job at flood control, but I did it with a lot of money behind me. The federal government and the local government had sent billions of dollars in to fix this issue. So I was doing it with the haves. And public health offered the opportunity to try to bring some of that same mentality and philosophy to the have-nots, because traditionally public health is underfunded and poor across every part of the country, and they don't have the opportunities to expand service and get creative and do those things. And when 1115 waiver came up, it was just that opportunity to create the infrastructure that built the funds to really ignite the passion that existed within every department within public health. So let's run it like a business, which is what you and I talked about. Let's keep the margins low. Let's rent some cheap space. Let's have potlucks. Let's do this right on our shoestrings and not spend all that money. And then take what we earn and then find the best ideas around public health and invest in those, which is exactly what we did. And so, yeah, the 1115 waiver, the 5 projects were fantastic, all successful, all of them met their metrics. I think I'm more proud of the things that came out of it that didn't necessarily fit within that box. Yeah. Where I don't think I told anybody that came to me with a good idea, no. Because we had the reserves to be able to invest in the innovation and the transformation that existed within every realm of the agency, but just had never had an outlet to move forward. And so we were able to be catalysts for that. And that ended up growing the 1115 waiver program to where you weren't just doing the 5 projects.
Absolutely.
We were actually incubating through the PHI labs, what we called it, the Public Health Innovation Lab, all the projects from around the agency. That was just the genesis story of it.
Yeah, and so when you look at that, and you look at this ability to run it as a business, and then I really want to hit on that culture shift that came through the agency. It was like one day it was heads down, transactional, and then one day you looked up and you just saw happy people doing meaningful work in a way that brought them joy. Yeah. And I want to talk about that a little bit, because I know at one point you leave the agency and then I get to backfill your role. And I'm really sitting here trying to figure out, can I do this role? But had a great teacher, so I felt confident in doing it. But really want to talk about some of that sauce that was made and where you took it on your next journey.
Yeah, thanks. I think that's a great question. I want to back up a little bit, because when you talk about the people's faces, I just want to remind you of our mobile health events. Yeah. There was one in Galena Park that specifically comes to mind. And if you remember, we had the virtual reality bus that came out, and it was an emergency response vehicle by day, and by night it could turn into this virtual reality component for people to go in. And we went to this community, which is an underserved community, and we had food there from, I believe, Common Market was doing the food. We had dental services, but watching you dance.
Oh, come on.
Maybe I may date myself with this one too, but to Dance Revolution, my friend, with a couple of little kids, and to see the face that just lit up when they were doing, not just theirs, but yours. Everybody got joy from that, and everybody that walked past that got joy. So I feel like we brought services, but to your point, we brought joy to the employees and to the community in a way that I'm not sure still exists there anymore, but I'm very proud of how we did it, and the fact that it didn't cost the taxpayers of Harris County any money for us to be able to do that for them when we were doing it. So certainly that piece is unforgettable to me. I'll never forget you dancing. Okay. It is in my head forever. At least I'm going to try to keep it there forever. But I got to a point, we had done that, we'd done great things. The county was changing in different ways, and I just felt like I wanted to make that impact across a broader spectrum. Like I really enjoy the innovation and the transformation aspects of taking an organization and figuring out how to make it more nimble, to find out what the love and passion for people is and bring that out in a way that they can execute on and solve some of the problems they have about financing and project management and technology, which the passionate people often aren't experts in. So I felt like I could solve that. But I felt like I wanted to do it on a different scale and across a broader piece. And so I went in to do a little private consulting. I left February the 29th of 2020 and retired technically from the county. But I did not know that COVID was going to be what it is 2 weeks. I promise you.
I think you did.
I never would have left you all behind if I had truly known that. It was a leap year, so it was a strange day to begin with. but went and tried to do this in the consulting and did fine. It was the COVID time, so the whole model for consulting had changed. It was more, back then it was built on lunches and private meetings, and then everything went virtual and Zoom and people working from home. Did okay. But I also learned part of the perspective I was missing. It was a growing opportunity for me. So I realized that I understood the system from my perspective, but my aperture into the entire system was pretty narrow. And I felt like there needed to be this broadening in my understanding of what happens at the state level and how that bridges to the CDC and our other funders that I just didn't have in that environment. So as our mentor, Dr. Shaw became the Secretary of Health of the great state of Washington, as he says, he asked if I would join him, and it just felt like the right thing to do. So we took the model that we had in Harris County and put a different flavor on it to match what was happening in Washington, but the goals were the same. How do you find people's passions? How do you create the structure that they can be successful moving those forward? And how do you just do things that have not been done, but people think they should be and know they should be to make the public healthier? And I was afforded the opportunity to do that for 4 years in Washington State. A great group of people that I worked with, and recreated the lab in a different way that fit the culture and the organization there, and had some successful wins as of innovating and finding projects to incubate and move forward. And I'm very proud of that work. And then came to Colorado to work in the behavioral health space, and I see the opportunities that exist there. But my overarching goals are still to bring that sense of creativity about finding solutions, bringing solutions to life, and solving the problems that people in the agencies across the U.S. in public health, no matter at what level, know exist, kind of know how they should fix them. They know their community, but don't know how to make it happen. And I think I'm a catalyst for helping make that happen. At least I hope I am.
Yeah. So there was one thing that you used to always talk to me about, and it was really understanding the dynamics of the environment of public health and the ebb and flow of capital and resources. One day it's here, one day it's gone, and not really throwing all your eggs into the human capital bucket, but building sustainable tech infrastructure to meet the needs of the changing environment. And I know that's one of the things that you did in Harris, but I do know that when you moved up into Washington State, there was a pause that you took. And you said, I'm doing evaluation of the tech stack to get an understanding of why do we have so many systems, and out of all of the systems, who's bringing the value? And if we do have to sunset, what takes its place and why? And so as you were going through that, I noticed there was two kind of evolutions going on at the agency as I'm sitting on the outside looking. There was this one where Washington State is becoming more visible. It's becoming more visible. There's a new partnerships chief. I see the partnerships bridging between the for-profit and the public sector, especially at the end of COVID, with your partners from your Amazons, your Qualtrics, your Microsofts, and also looking at the places where people would come together, storm events, the NFL team events, and really looking at this like new rebrand and elevation of, like you said, you walked into public health and was like, what is this? And I saw it happening to where people were now starting to recognize, like, there are people here that safeguard us from harm. And the thing that comes with when people know something, now you really have to deliver. And I think you were working on that on the other side with saying, well, how do we take a very intentional step in service delivery that's data driven, but also understanding that we just can't get the data, we have to act on the data. So just want to hear about some of those things that you guys were working on.
For sure, it's a great question. And to go back to kind of the genesis, when I came in to government, I was astounded at how lack of tech there was. And from an investment standpoint, people just, I found, didn't invest, these large companies invest in tech stacks for government. This was obviously back in the early 2000s, and that matured over some part. But when you look at public health specifically, the infrastructure of public health, technology-wise, was underfunded for at least 30 to 40 years when I came in. So we're now into a 50-year cycle where there hasn't been a lot of investment in the underlying tech stacks So you're working on old technology. And old technology is inefficient, it is effective, it is nimble, it doesn't lead to good innovation. It makes the work of the people who are trying to serve the community harder, not easier. So my perspective has always been, how can we find tech stacks that make it easier for the individuals that are passionate and want to be in the community to get their work done without having to focus on all the stuff that has to happen in the back end because they have low end or old tech. The pandemic, interestingly, offered this catalyst in the industry of the tech industry to change that dynamic. And you saw a lot of companies come in and do work in public health. I took a pause because I wanted to see which of those companies actually wanted to stay in the space when the federal money went away. So we worked very intentionally to build what I would call strategic partnerships. Weren't built off sales cycles, weren't built off RFPs, weren't built off anything. Then we're trying to do good for the community. How can you help me do that now that you know my vision? And we'll talk about the other things when it's the right time. And being in the Pacific Northwest, I couldn't have asked for a better place to do that because there is the conglomerate of tech entities there: Amazon, Microsoft, Qualtrics, Salesforce, ServiceNow, you name them. They all were at the table because it was their community that was being impacted by the pandemic, and they inherently saw the underinvestment that had been made in this space and wanted to help. They wanted to help immediately, and they did. Most of them came in, and that includes non-tech partners too. So you mentioned some of the sports teams. Everyone rallied around the community in Washington to solve the problems that public health was facing during the pandemic. As the pandemic waned and we went more to normal operating protocols and environment, many of them stuck around because they saw the same passion and the same impact on community that I saw, and when they interacted with the teams, they wanted to be part of that. And those are the ones that really became what I would consider strategic partners. And in many ways, I would consider most of them a lot of friends because they are on the same journey. They're just coming at it from a different angle and perspective, but they're still invested in making public health better, easier. And I think the key to that is not only that, but make it sustainable. Obviously, the 30 to 40 years worth of investment a long time ago wasn't sustainable for the long term. So once we started catching up with newer technologies, how do you make that in an environment where a local agency or a state agency can continue to evolve it? And that's with modern tech stacks that's low code and SaaS platforms that are offloaded in someone else's cloud, rather than these big infrastructure projects that have our own data centers and our own technical experts of 15 people that know this one program related to public health.
Absolutely.
And you and I were talking earlier, that is a genesis of the funding model that existed for so long within the CDC and the USDA and the other funders around public health. Is they trusted program would call and say, hey, I need this piece of tech, and they would write it into a grant. But there wasn't a strategic view of how that fit within the portfolio of all the other tech stacks that exist within the health agency, how supportable it was for the long term, what the overall cost of ownership was going to be, or how do you transition that to something else over a period of time, and how flexible is it in the transition? So I'd say the COVID, while it was a terrible thing for the US and for everyone, it also was an opportunity for public health to get into the spotlight, for people to know what it is, and people to become invested in making the entire ecosystem better. And that's what I saw in Washington State, and I think I still see it today. There are great companies that are still invested in that space and trying to make it better.
Yeah, you know, when we were at Harris, it was always, you want to know tech and innovation, look at Harris.
Yeah.
And then when you all transitioned to Washington State, it was, if you want to know about tech and innovation, look at Washington State.
Yeah.
And I remember like there was a very focused intention on you all as an agency at the local level when we were all together, and then even at the state level of engaging the tech community and explaining the story beyond COVID. You know, when I came into, and I left the agency to go into the tech world, I spent a great deal of time explaining to people that public health was not COVID.
Yeah.
Like COVID was something that public health responded to, but everything around you is public health. And when you break it down and explain it to people, I think it gets to the point of what you're saying is folks understand now. And I think our mentor, Dr. Shaw, put it extremely well when he explained public health being the offensive line of a football team, can't get past it. Even though he's a Cincinnati fan,
we're not going to slide.
Yeah, we're going to let it slide. We're not going to charge him for it. But when you made that analogy, it resonated so well with people because it really put people on notice to say that there are people who are nameless for the most part, protecting everyone else so they can deliver.
Yeah.
And as I saw you all make movements around and showing up at tech conferences where public health folks were not traditionally at.
Yeah.
And still, they're getting more involved in it, but traditionally they weren't there. You all were going to the public health conferences and forums, and you all were delivering extremely high on those markers. But then you're moving into these tech environments. You're showing up at the AWS summits. You're showing up at the Qualtrics X4s. You're showing up at, the places up in, Silicon Valley. Mm-hmm. And folks are starting to now listen. Yeah. And they're starting to understand. And you all then took some of that and started ideating and building ideas. I distinctively remember the entire Washington State leadership team, or the majority of you guys, coming over to Qualtrics Tower and sitting with our tech leadership team and laying out this vision. And by the time you all walked out of the room, we're just sitting there saying, we've never even imagined that was a possibility, or we never even imagined our technology playing that well in this space. Yeah. And we went on to do some great things together. And I think right before you all transitioned out of the agency, we're about to start a second revolution or evolution of something great. And you all were really challenging us as tech to really say, this is what we want to do. You do it well over there. Can you do it over here?
Yeah, you make great points. And when I think back to Harris County, and I mentioned this, we went from the haves at flood control to the have-nots at public health. There wasn't a lot of infrastructure, and we built that over however many years that you and I were there to a level where we were a premier in the nation. Mm-hmm. I think not just because of the tech, because of the unleashed passion in our employees that created the opportunity in mm-hmm. every part of public health. The animal shelter, mosquito control, environmental public health, some that don't often get the popularity when everybody thinks COVID and vaccines mm-hmm. and disease surveillance, but are critical to communities. But we brought that innovation to every one of those. Mm-hmm. Going to Washington was a little different in the fact that they started at a really high place. Washington, before Dr. Shah ever got there, are one of the premier state health agencies mm-hmm. in the nation. So it was an honor to be able, and humbling actually, to be able to go into an agency like that and see, can you even make him better, right? And so I'm fortunate because of the opportunity. I'm fortunate because I walked into a place that was already at a very high level and mm-hmm. with a tech ecosystem around them that allowed that strategic partnership. But what we felt is, one, we wanted to keep people engaged. So I think part of the strategy was around creating strategic partnership was certainly to make sure people stay engaged with our agency, but we didn't want our tech friends to forget what public health was and why they joined the mission to begin with. Mm-hmm. And so part of our strategy about going to those conferences and having those meetings was to just tell the story of public health, to keep everyone focused on why they came to help us in the first place and how there's opportunity to do that in the future. And there are some great ones that stayed in that mix and moved along. The second part of that was to tell the story to our peers mm-hmm. around the country, because what we kept hearing is, well, we can't do that because we're not in the Pacific Northwest, or we mm-hmm. can't do that because we're not Washington State, or we can't do that because we're not the size of Harris County. But I really feel the model is replicable across the entire ecosystem. It may not be to the scale or size or the same partners, mm-hmm. but there's a way to create those opportunities for public-private partnerships in public health that lift the tide of all agencies, no matter where you are in the country. And I think that's still true today. I think mm-hmm. there's still that opportunity to continue to tell the story of the great work and the passion of the people and get people to pay attention. And like you and your team at Qualtrics, to say, man, we've never heard it like that before. How do we keep this going? Mm-hmm. Because it's special. It's not selling, no offense to any private sector, it's not selling to another private entity, it's not selling to a bank, it's not selling to an insurance company. It's putting a product in a place that's going to create greater good through the community than mm-hmm. probably they can even imagine, because they don't see it on a daily basis. And that's a real opportunity. And I think the opportunity is still into the future, because it isn't too late. while people have hopefully moved on from the pandemic and back to more of a normal life, it's still there. And what we can't do is revert back to, hey, we'll invest in public health in another 30 years, or as Dr. Shaw says, only when the next emergency happens.
Right.
Now's the time to really capitalize on making sure that we're getting things right. So when those bad things happen, and they're going to happen again in one of those different areas, we're prepared. The community is going to be better off for it. The people will be better off for it. And in the end, I think there's a lasting legacy that we can add to that work. And I'm very proud to be part of that. I'm proud that you were along that journey for me, and I hope it continues into the future.
Oh, absolutely. You're stuck with me.
Okay.
You're stuck with me.
Well, you're going to have to dance again. Just there.
So, we talked about the projects, the programs, the passion, the public-private partnerships. Now I want to kind of dive into your brain as operations and finance, because a lot of the story that we hear across the country is, well, we just don't have the money to do it. Or, we just don't see the value in that. Or, oh, that's going to cost. And sometimes I think we lose sight that you got to spend some money. You have to make an initial investment. What would be your messaging or?
I'd put it into 3 lanes, really. I think the first lane is to acknowledge that it is expensive and they don't have the money. I think on the surface, that is all 100% accurate. And from a traditional perspective, I completely get it. I think what isn't often told in the story of public health and within health agencies is the cost of the old infrastructure on productivity, on satisfaction, on even recruitment and retaining employees. Because no one wants to come work on these old systems if you're a smart techie. And the techie isn't there to necessarily deliver service to the community. They're there to make it easier for the others in the agency to deliver that service. And so the harder the tech is to use, the harder it is to get data out, the worse decisions you make, the more time people spend. That's less time working in the community to actually make it better. So I think there's an opportunity cost, if you want to just explain it that way, that when you don't invest in the tech infrastructure and the tech stack and the partnerships, you're actually costing yourself and your agency a lot of opportunities to do different things. So I'd put that as the first bucket. The second bucket is to again acknowledge that it is difficult to find the funding, but public health needs to tell the story to the elected officials, to their legislatures, to the federal side, why it matters, why it's important, and what the impact of not doing some of these things will be to the community and how it's going to impact them. So I think second bucket is we need to tell the story of public health and the impact that this investment means and what it means to the agency. I think about, we were talking about eligibility, enrollment, and integration across multiple systems that exist in almost every entity, where multiple agencies need to do verification for FM, a federal map to Magi or non-Magi. We can get into the technical terms, but how much someone makes and if they're qualified for a program. We're terrible about sharing that data. So you have an individual that comes in and they want WIC services, for instance, and we'll do the qualifications through a process and maybe automated, maybe not. That person is eligible for other services that they probably don't even know about, and that their eligibility in that one system could open up an umbrella of things that may be causing problems for their lives that we can solve. But we don't have the infrastructure to make that seamless. Paper applications, fill out multiple applications, fill them out every so often. And I think applications and making sure people are eligible for services is valuable, but that investment in a person when they have such a hard time in their lives that they have to come to us to get assistance. I probably haven't spoken much about this in public, if ever. When I was very young, before any of those things, and I had a young child, we went on Medicaid. It's an emotional time to walk into one of those offices and have to fill out those forms. You don't feel excited to do it. There's an element of, what did I do wrong? Why can't I do these things? But to make that process harder on people at that moment in their life when they need us most is almost inconceivable. So why are we not investing in the technical infrastructure to make that easier? So you come in and you get, you need WIC because you have a small child, and that child needs that food. You also are eligible for this, and if you need housing support, if you need education support, you don't have to fill out 15 more forms and go to 5 more different agencies and take appointments during the day while you're supposed to be working to make that happen, because we've figured out technology solutions that exist today that make that easy. Like, it's such an easy problem to solve, but it's such a hard problem to solve because it requires collaboration across the entire system that just isn't there yet. But I want people to hear those stories and think about them from that lived experience lens. And then I think that story is a lot easier to engage with elected officials and legislatures, because that's what they're concerned about. I can talk all day long about no-code platforms and hiring problems for technical resources and programmers or AI or you name it. That doesn't move people. What moves people is the single mom that had to take off 5 days of work to go into an agency to fill out a form, only to learn they needed to go to 2 other agencies and fill out 2 other forms with the same data. That doesn't leave a good taste in people's mouths, but it motivates your elected officials and the people that can allocate that money to make the investment in the system. And then I think the third part of this in that triad is, I think we have to be more creative in the financial management space of public entities, not in a negative way where you create risk for the agency, but really pushing back on terms and conditions you may get from a grantor. Just because they write X program into a program grant renewal, if that program isn't X program, I should be advocating to not do that and to do what's right for my community and push back on the funders to say, no, I'm going to invest in this tech stack, or I'm going to carve out this amount of money because it's going to make that much of a difference. That flexibility is what people often don't sense in the contractual relationships for the funding on public health, because it's usually coming from a federal agency or a local board or commission, and they don't feel like they have that wiggle room. But I've found that if you look at the contracts and the language, we pin ourselves in to what we think we can't do, and we don't look outside that box to find other ways to do it. And so creating the creativity is kind of that third pillar, and doing things the right way and according to the contracts and the legislation and all those other things, but pushing the boundaries where you can to make sure those investments line up to what's long-term sustainable, what fixes the problems in those stories, and creates a stronger agency, which is what I think we did in Harris County very well.
Absolutely. Because a lot of folks don't know, and I tell folks to say, you can't look at your public health system as you would do your safety net hospital system. I was like, we're not talking apples to apples in funding. We're talking about probably a 500x, more investment on this side than they're doing in public health. But you're responsible for everything outside of the 4 walls of that system. And when you say in public health, it happens where you live, learn, work, worship, and play. That's everywhere. And folks don't understand the totality of public health. Like you were naming all the services and divisions from, mosquito vector-borne diseases to stray dogs and veterinary medicine, to environmental food inspections, to wastewater contamination, to you name it, it's in there.
And some things people don't even realize is in there, right?
Absolutely. And so when you're talking the story about testing the boundaries, a lot of folks don't understand that you all in the industry is doing that of public health. In most cases, they're not really funded heavily at the local level. They're dependent on 80% of their funding coming to those very restrictive places that are saying, you shall do this and not do this. And so it kind of puts you in that box to where the 20% is paying for the support of all the programs that the program won't necessarily cover.
What I will say in Harris County specifically is the model that I just explained actually led to investment at the local level. Because we were addressing things in the right way, because we were telling the story and using data along the way, we were able to tell great stories and get an investment. In fact, as you know, we doubled the local investment in public health over a 3.5 to 4 year period, which is dramatic and was meaningful to the community. And it gets back to that story that I told about you dancing in the community, because as Dr. Shaw has said, and Dr. Palacio, who used to run the agency in Harris County before he did, public health is inherently political. You have to realize that. And so if you're going to move it forward, you have to understand the politics in which the system you work and leverage those to best you can to move the things forward. And what we did is we invited those elected officials to come see the same things that we were seeing. So see the people in the community that were being impacted in a super positive way, that were smiling and happy. They weren't working out of a government building with a form feeling like they haven't been heard, that people didn't understand their problems or want to help. They walked into a situation where they felt like people respected them, heard them, and wanted them to get into a better place, and we wanted to help them as much as we can. And that created smiles, it created an energy, which I can't probably even describe in this room. It created energy that lasted, and when elected officials came and saw that, they wanted to invest in that value for their citizens and their community. So it is telling that story and moving it forward in a very different way. Also want to say that, I've been so fortunate because I grew up in the tech side. So I started out in tech. I got the opportunity to learn the business side and finance and all the other things. And then I actually got to run the programs. You and I have had this conversations. I got teased many times about driving the vans and wearing multiple hats. Probably the best thing I ever did in my career, and this credit to Dr. Shaw for allowing me to do this, when someone would leave the agency, as you know, or we would leave them the agency because they weren't the right fit, it happened both ways.
You would take on the role.
I would take on the role for a period of months to figure out what was needed, what kind of person we needed in the role, but also try to fix some of those structural things that weren't aligned to mission and strategy where we're going. But the benefit of that is I learned every program from the program view. So I ran HIV programs, I ran vaccine programs, we ran clinics together, we ran mobile sites together, we ran dental programs, but I ran the animal shelter, I ran the mosquito control agency. So every part, except for environmental public health, because I never had to, but had such a great partner on that. You know him well. Probably should have him on at some point as well.
Absolutely.
A great partner that had the same vision and could execute in the same way, so didn't need to do that. But that has really helped me over the years of knowing tech, knowing finances, but really being able to put the program lens on and understand how program thinks and tries to solve their problem and marry those three things together. So I'm fortunate in that respect, and I'm grateful for that opportunity. And I think if I have any advice out there to my tech friends that are in the space and trying to do the same good, learn program, listen to program, and find out where their issues are, where their challenges are, and then work backwards to the financing and the tech. Don't start with the tech and the financing. Really has to start with that problem of your why. Why are you here? What are you trying to solve? And how does that fit with the agency? And just got the lucky experience of being able to do that in many different places with many different hats.
Yeah. So I want to hone in on one aspect very selfishly. And I want to hone in on the aspect of everything that you've talked about. There's always been one common factor, and it has been the experience of people. And I know, was it 2 years ago, you had a chance to come to the Experience Summit hosted by Qualtrics in Salt Lake. And I think when you walked in the room, you were trying to figure out, like, what is going on? What is that? What are you talking about? But when you left, you kind of had this different view of human experience as it relates to the passion in the program areas of the bodies of work that you were pushing. Like, you can't solve for what you don't know. And you know anecdotally that there is disease spread in the community, but why? So you get into like some of the epi pieces, but it really took a more qualitative look at things, and you kind of sat back and formulated some things and you kind of ran with it. Yeah.
Well, I think because it's one of the missing elements, because I mentioned storytelling and I mentioned community a lot, and then that certainly ties to tech. But what I had not run across was a lot of tech that could combine those things together. So when I went to Qualtrics, and we didn't have Qualtrics in Harris County, state certainly had it, and started learning more about it. And what I found is it was a great vehicle to do a lot of the things that I checked off as I was talking through this journey with you, of investing in robust tech stacks that are modern and configurable and don't have a lot of overhead in them. It allowed us to move forward with collecting a lot of data. So we made data-informed decisions about what was happening in a really easy and seamless way from a public and community standpoint. It helped us recognize community in many ways, because community is different things to different people. It isn't geographical always, and we often try to put it in a block or a square or a rectangle on a map. And Qualtrics really helped to define maybe where some of those boundaries weren't exactly on the line to expand the broad of community, but it also allowed us to get the stories about what is happening. And the stories often give you feedback about things you're not doing well and opportunities to improve. So I think if I look across the entire spectrum, it really helped check a lot of those boxes about what we were trying to do, and fit nicely within the tech stack that I was trying to build within the agency that was sustainable for the long term, offer the ability to grow and mature with the agency. And so it was a natural fit, but I just didn't have the perspective at the time and needed a little bit of a primer, if you will.
Yeah. So even as you go through this journey and you're in this new space now, but as you continue to move forward and look at the technologies that are emerging out there on the horizon and knowing some of the problems that we have, I remember one of the funniest, non-funniest things, as I look back on it now, it's funny. In the moment, it was not funny, was in the middle of COVID. We had an opportunity to get a visit from the U.S. Digital Services Group as they were going around the country trying to figure out where were the bottlenecks, what's going on, what's happening, why is it taking so long. There was so much paper in this process that they actually took a picture of our fax machine. Now, you can laugh about it because you had left me 6 months prior too, but they came and they took a picture of the fax machine. That picture ended up on the front of the New York Times. And it was just paper, like the ream boxes of paper. And it was just faxes. And you could not hire enough people to input the information. And by the time you put the information in, they were like, oh, self-quarantine for 14 days. You look at it and you're like, it's a little bit past 14 days because I think there was an absence on two sides. That there was the infrastructural issues of legacy tech systems that were not modernized in order to digitize a lot of that stuff. But I think there was also a neglect from a people's perspective to understand everything that was going on in COVID. In that the same people that were responding to COVID were also the same people that were being impacted by COVID. So while everyone else was doing at-home schooling, well, guess what? Public health professionals, they had kids who were also doing at-home schooling. While other folks were trying to figure out how to go wait in the line at the supermarket after work, they were trying to figure out the same, but they were doing it still at the office, working 17, 18 hours trying to figure out like, what is this and what's going on? And it created a burnout. In not only in public health, where we saw, I think in every public health report that came out after COVID, was like there's this mass exodus and gap in employees. And it came to the point of what you're bringing up around lack of tech modernization, lack of having the tools to be successful, and just sheer burnout, because I was burnt out and I was air traffic controlling. There was a difference in the folks who were actually having to figure out how to crunch the data together to tell the story to an elected official who was not well versed on what was what. And that was a national issue. And so folks said, you know what? I'm done. And so when you think about technology and leadership, and you think about it from an employee perspective of when public health gets noticed, because you'll notice this when it goes wrong. What do you have to say to the larger community about upfront investment beyond the crisis and long-term human capital strategies around employee engagement?
Yeah, COVID was novel in the emergency response area because, as you know, in Harris County, we averaged an emergency response between 6 and 9 months for our entire tenure when we were in the county. Most of those were hurricanes or floods. And to your point, it wasn't the entire community that was impacted. It was segments. So employees coming from other areas that weren't impacted could fill that void and do it. When the entire infrastructure of your agency, and I think that lets you get by with some tech debt, because you can throw people at it. Those people are fresh. They're trying to solve an emergency. They're engaged because it's their community. They want to fix it. When those incentives for them are dropped away because they are experiencing the same emergency as the entire community, I think that lack of tech debt, or that tech debt and that lack of investment in tech, really showed through. To the fax machines, this wasn't a new problem, we knew, but it was manageable on a small scale or a relatively small geographical area. You didn't have to have interoperability with EHRs. You didn't have to have tablets, because you could kind of make up for it in the system. And I think what COVID shows us is we're not prepared from a preparedness standpoint to deal with a community or nationwide disaster without the investment in the emergency infrastructure. And I will say, from my perspective, that investment in the emergency infrastructure is often difficult because we see it as an investment only for the emergency, when really it should be an investment for the emergency and the blue sky days. That's where the ROI is. It isn't just investing in the tech for X in emergency response situations. It's building tech that is capable of being interoperable, that is expandable, that is configurable and adaptable, so as the situation changes, it changes with it. And that just didn't exist, which I think led to the frustration with employees and the burnout, combined with their personal situations not being remediated. And so I think you saw two things from a human capital perspective. I think you saw people come in, work through the emergency, get burnout, and leave. I think you saw people that were in for a long time that went through the emergency and said, I can't do this anymore. It's taking too big of a toll on me. So you've had a mass exodus and a high turnover at the same time, which for me is a great argument of investing in the tech. Because what most of the things that left was institutional knowledge. It was on a piece of paper. We need to get it off a piece of paper. This is why AI is such an opportunity. We can get things off a piece of paper and put it in a system that's retrievable. In the 2000s or so, we took things off of paper sometimes, but it wasn't retrievable. That combination has to exist for it to have value. And the value is to make decisions. So what do I have on pieces of paper in file cabinets somewhere, or digitized in a folder somewhere, that has valuable insights that I could use to make a better decision for my community that I can't access? That's the value proposition with the investment that we're at today. We need to invest in all of those things so that the decision makers, regardless of human capital, regardless of turnover, can make the right decisions for the community. And I think that's what the community expects. They just don't understand the back-end system and why it would get out of sync, because that's not their system. It's our job to put that in sync. And I think it's going to require telling the story, why it's important, but some creativity around those investments and thinking about blue sky days and emergency situations as one, and multiple use cases for single systems. I know it sounds novel, but it's where we should be.
It's where we should be. So recently had your first grandchild, which brought you from Washington State to the great state of Colorado.
Yep.
As you think about all the things that you've talked about, from the antiquated ways of doing things to the modernizing way of doing things, to understanding the joy of helping others at their worst moments, just the bodies of work that you have just invested yourself in as a professional. When you think about your godson, who you're smiling now because every time I say the word, grandchild, you're like, oh, grandpa's here.
Yep.
When you think about that and you think about all the things that you've encountered, hurricanes, tropical storms, Ebola, H1N1, Zika,
West Nile,
chikungunya,
you name the virus,
COVID.
Yes.
And you think about how technology could have helped us move quickly through some of these things, or have better predictability of certain things. And when we're in the space, we look at it and we say it seems to be getting progressively more frequent in certain things. Yeah. You think about your grandchild, growing up in, what we say, the public health environment. What is it that you want to see changed as you think about, it's not about me anymore.
Yeah.
It's not even about the girls anymore. because you don't even talk about them anymore. Sorry.
Fair.
But you don't even talk about them anymore.
Love them.
Yeah, you love them, but you don't even talk about them anymore. It's the grandchild.
Yes.
So when you think about your work and the things that you've tried to transform over the years, in that context, what brings you hope? And then what things kind of frighten you?
Yeah. There's a bit of irony in that story for me. So first, in public health, I should have probably paid more attention to my own health.
Yeah.
There's some stories that you can tell about the number of times I walked around with Coke and just drank a lot of sugary beverages and stuff that really wasn't good for me. And I think towards the end of that journey, I started to see that I was neglecting my own personal health. And certainly family situations like parents passing away highlight that for you. But for me, I call him the grand buddy now because he's my little buddy. When he came along, it was really about, okay, I want to be here for a long time. I want to be able to enjoy life for him. I want to be able to go to the park. I don't want to worry about Zika or dog bites or anything. I want to be able to enjoy. I don't want him to have to worry about the environment he lives in and grows up in not being healthy. So there's an incentive there for sure, but it's almost a little selfish from my perspective because being on this part and being a grandparent now with a grand buddy, I want everyone to be able to live that long, healthy life into their golden years and have that same experience because it is freaking magical. It really is. But if you don't do the work up front, if we don't invest in those communities for the 20-year-olds and 30-year-olds now and the young child's it's not going to be sustainable for them in the long term. They're going to have to worry more about health than they should in their life. And then, you and I, you came from healthcare. We've talked about healthcare many times. There's such a large investment in healthcare, but not in health, which is where the public health realm sit. And it was always frustrating because no one wanted to hear the public health story. They only wanted to hear the hospital story or the healthcare or the cancer registry or these things that are always to part where people are sick and not enjoying their life to the fullest. And so if I can make even a small, meaningful dent in moving that continuum over to where we're thinking about health, where it's something that people don't have to think about so much, and it's just healthy environments for them and healthy food for them, and they can be healthier in their lives. And I think I'll feel good about what I did, and it just amplifies the fact having a young, small grandson that I know is going to grow up well beyond me being here. And if I can make a lasting impression on that environment for him and others, then that's pretty satisfying and gives me some hope for where we're going and that next generation, which is at this point in my life, you keep aging me, is what I always want to kind of think about. It's that next generation. It isn't about me anymore. I've passed that point. I am the older generation that needs to be thinking about what I pass on to the younger generation. And I think public health is just a core component of that story for me.
Nice. So last few minutes, few questions. Why
am I getting nervous about this last part?
What is the number one thing you miss about Texas?
Food.
I knew you were going to say it.
Yeah, Tex-Mex. Yes.
Oh, really?
Barbecue.
I can replicate barbecue.
Uh-huh.
It's the Tex-Mex. I can replicate it a little bit. It's kind of hard. So we'll order our tamales from the valley. So we get our fix every once in a while, but it really is the food. And to be fair, we were so blessed in Harris County because there's such a diversity of food. You could get the best food in the world in any type of cuisine you wanted, and it was really readily available. As you move to other places around the country, it's not the same.
Yeah.
And so definitely miss that. But that is probably better for my health, to be quite honest.
Favorite experience thus far with the grandson?
We have babysat him now for a whole weekend twice. And having him wake up in the morning and look at me in the crib and start clapping when he sees me was worth everything that I've ever done.
Nice. Let's see. Last question.
Gonna get us some feels here, geez.
Last question. I don't have a last question.
Well, I have a last question for you then.
Oh, I knew it was coming.
Is that fair?
That's fair. What you got?
Okay. What do you miss most about working together?
What do I miss most about working together?
Yeah, because we worked together for a long time.
A decade.
Yeah.
Worked together for a decade. What do I miss most? I can't say I miss the friendship because I don't care where you are. I've seen you in every state you've been in.
That is true.
But I think what I miss most is the thought. Sitting in a room with you and just the conversation. Not even the conversation necessarily about work, but just the life conversations. Like, I probably know more about, the girls, and you can see in knowing in those personal touch points what actually drives you to do the work that you do. And those are moments that you and I had an opportunity to talk to each other, because we both have 2 daughters. We both had the horror stories. We've both had the boyfriend moments. We've both, had the college moments, and being able to just bounce that off. And you know what? The funny thing is that the 2 Michaels had the same dynamic.
Yeah, that's true.
So we were all leaders in the same agency with the same household dynamic.
Yeah.
But what I miss most is just walking into your office, seeing the 20-ounce Coke on the desk, knowing that was probably number 6 of the day. You telling me that, as I'm lecturing you on drinking more water, telling me that, you see this cup?
Oh, look at that.
This cup is full of ice.
Yes.
And this ice is going to melt. So I filled this cup up 6 times today, so I'm getting all the water that I need.
Turns out that wasn't such a good analogy, and I may have been wrong on that, but I really appreciate bringing up the girls, because you were going to get me in trouble for the earlier comment about forgetting about the girls. They were our lives growing up, and it was great to share.
So he talked about you every day.
Yeah, we did, because we had that in common.
We did.
That life journey.
What story do you have for me today?
Yeah.
That was the icebreaker. But I really do miss the innovation and the creativity. Like, the ability for me to walk into a room, sit you and Dr. Shaw down, bring a team in, and that I'm about to walk into a room and ask for something. Because I say, just keep an open mind. And then here you'd say, oh, well, that means I'm about to spend some money. And I've been like, in a good way. But to have a leader that would actually listen to the idea and respect the idea and see the vision, and then say, go do it.
As I said, one of my proudest moments was never saying no.
And to then look back on it and say, it worked.
Yeah.
And, and I tell folks all the time, I said, folks will call me and they'll say, well, Will knows public health and Will knows this. I say, Will knows public health as it can be, not as what it is. I said, because I had leaders and mentors like yourself and Dr. Shaw who said, go out and do. And I remember the phrase, keep it fair, legal, and ethical, because we're not going to jail.
It was a criteria. But to be honest, people brought good ideas. I can't think of anybody that brought an idea that wasn't, at least at its core, something to pursue. So maybe you had to work around the edges, you had to frame it in a different way or move it forward. And I really mean that. I'm proud of never having to say no on those investments. But the people that were bringing those ideas forward put a lot of thought into them, really articulated what the problem they were trying to solve was. And so how do you not invest in that passion, which is,
absolutely,
I think, the great thing that we were able to do together. And
absolutely
happy we did it.
I know. I said one of these days I was going to catch you and tag back up, work with you again. And I've had the opportunity to do that.
Yeah.
Followed you to Washington State. We had a chance to kind of do something really cool there. And now you're in this new role, and see kind of where we can go from there. But have always enjoyed the opportunity to work with you and just learn from you. And every room that I walk in and your name comes up, it's nothing but positivity. I was with the old members of the team last Friday. I was with Richard and Harold. Y'all don't know Richard and Harold, but we know Richard and Harold. And
you should know Richard and Harold.
Yeah, you should know. And the only thing we were talking about was like, yeah, Les was the man. Harold's like, yeah, Les was the man. Richard's like, yeah, Les was the man. And I was like, I agree with you. Les was the man. And I said, well, I'm gonna see him on next week. And they were just like, really? And I was like, yeah, I'll see him next week. And they were like, great. And so they wanted me to pass on to you, give him a call sometimes. And I said, well, you could hop a flight and go see him, he's not going anywhere. He's going to be where he is for a while, thanks to Grandbuddy.
Yeah. Yeah.
But yeah, that's what I miss the most. I miss the camaraderie, the stories, and just there was something new every day happening in Harris County.
Yeah.
Like it was never a dull moment in any aspect. One day it's a plant fire, one day it's a hurricane, one day it's an infectious disease, one day it's we just don't know, but it's something. And sitting
Flat
down,
tires on the mobile vans. Like,
yeah,
there was always something.
but it's sitting down and just saying like there was never a time with you where it was, oh well, we can't solve that. It was a matter of, okay, here's the problem. This is how long we have to fix it. What are we gonna do? All the ideas to the table. All right, go do it. And you don't get that often. It seems like sometimes there are leaders that I've worked with who get perfection paralysis. Like they get to a point to where it has to be perfect in theory. And I'm sitting at the table saying, I don't know what vacuum you living in, but that ain't it.
Yeah, I mean, it gets back to our conversation a little earlier. It's the risk component. And I think people analyze the risk without truly weighing the reward. And I truly think everything we did, the risk we took, certainly the reward outweighed whatever that was.
Yeah.
And we did it in a responsible way because the reward is that story.
Yeah.
The reward is my mind having the visual image of you dancing with those kids.
Oh, God.
The reward is the people that we saw coming and getting food and carrying those bags of groceries to their car and just seeing how grateful they were for that. Those are the rewards that if you make those investments in the people that have the ideas and the passion, you get to reap. But we don't often think about that when we just see the risk in front of us.
Yeah. Got it. I'll take more questions.
We'll have to save those for episode 2.
Got it. Episode 2. Episode 2. Huh?
We need to hold that next episode hostage.
Yeah, we're gonna hold you hostage for the next one.
There you go.
Well, thanks everybody. Was glad to be able to sit down with colleague, but before that, really, 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 really great human and great friend, Les Becker, on this episode 2 of the Good Code Podcast. Thank you.
Thanks, Will.
Awesome, guys.